and I am the intake coordinator at Brain Injury Community Reentry. So some of you have maybe met me. If you're newer to the agency, you probably met me while doing your intake. And if you've been around a little while, I have been in almost every department. So we may have crossed paths at some time. This was a very long presentation, but I cut out a good chunk of it just to really focus on the services we provide. I'll do a little bit about us, which is we are a not-for-profit organization that provides support and services and rehabilitation to individuals living with the effects of an acquired brain injury. We were founded in 1988 by a group of concerned parents and professionals who felt that specialized services were needed in the region. A volunteer board of directors oversees our program and consists of an organization founder, rehab professionals, and community partners. Good. So we are funded by Ontario West, HNHB, the Government of Ontario, third-party payers, so that's people coming in with insurance dollars, and fundraising and private donations. So a big part of that is our golf tournament. We have been accredited by Accreditation Canada since 1997 and currently waiting to hear back for our most recent accreditation. We provide support to 350 participants, and I am going to guess that number is a little bit higher these days because I think this presentation is a little bit older. And we have about 135 staff. I'm also going to guess that that's a little bit higher these days. So eligibility, referrals, and intake. Anybody can refer to our services. You do not need a physician to complete a form. So although I say that, we do get referrals from physicians, from hospitals, from family members, from clients themselves. What happens next is, well, I think I'm skipping ahead. Typically, I get the referral and I am following up either with the person who's being referred or the referral source to discuss what the brain injury, the cause is, what services they're looking for, where they're kind of at in their journey. We provide services to individuals who are 18 years of age or older. And sometimes we have people coming in who are, 16, 17, 18, kind of on that verge of hitting that adulthood. We do not provide services to children. Typically, you're going through Hamilton Health Sciences, or I think it's Bloor Bayview, something like that in Toronto. Priority is given to individuals living within the Niagara region, and any specialized nursing needs must be addressed by other professionals. So there's a lot of medical stuff that we don't do. So again, typically a referral comes to me. I am meeting usually one-on-one, face-to-face with the person applying for services unless they're super far away. We typically meet in our office. Intake takes less than an hour. I ask a whole heck of a lot of questions and ask people to sign consent forms. So what we need is medical documentation of an acquired brain injury. So typically I'm sending out to places like hospitals, rehab centers, neurologists, sometimes family doctors, because we need that documentation to meet our eligibility criterion. So once all that happens, it all goes to our admissions committee. Admissions committee determines if somebody is eligible for services. If you are, you're going to get a letter from me because we are old school, and you're going to go on the wait list for whatever programs we discuss that you're applying for. Unfortunately, there is a wait for every program currently. And that time varies. Case management, you're looking at maybe about 4 to 5 months. Things like social work and psychology, those lists are a bit longer. And of course, our residential services, those lists are very, very long. We encourage family support. We encourage family support at the time of admissions and as you're moving potentially from one service to another. I don't think I need to say more about that. So I'm going to get into programs and services and probably very quickly just cover the big ones. But I'm going to start with services we don't offer because I get these calls all the time and people always have questions about this. So I will get calls regarding, I need physio, I need OT, I need a speech language pathologist. And these are not services that we provide. So we are not a medical clinic. We don't have doctors or nurses or any of these other paramedical services. What I typically do is encourage people to apply for outpatient at Shaver, which is our local rehab hospital. So they do offer all of these services. That is also a referral that needs to be done by a physician. So if you are very early in your journey, or sometimes you just need, some physio support, I would highly recommend asking your family doctor to complete the application and get on their wait list as well. There are very few options for having things like physio and OT and speech to be covered by OHIP. And Shaver is basically it in our region. You can also tap into Hamilton Health Sciences as well, but I know sometimes hiking up to Hamilton is really challenging for people, and Shaver is local to us. But intake services, I think I just already explained. That's me. I'm the only intake coordinator, so your odds are you're meeting with me to discuss our services and complete the application. Case coordination or case managers are typically the first person you're going to meet other than me if you have been approved for services. So case coordination is meant to be short term to assist with kind of immediate issues, and sometimes that's applying for ODSP, getting on housing lists, trying to hook up with a family doctor, things like that. Sometimes people are just with case management for a few months and that's all they need from us and their files are closed. Sometimes they're needing a bit more support and they're going to wait for more comprehensive services. Psychology services. So we have a neuropsychologist on staff with us, and she does like so many things. So she's also the clinical director. She does neuropsychological assessments. She supports our St. Paul program quite heavily. She also provides counseling. She does everything. So she is also obviously funded by OHIP as well. So there's no cost when you are meeting with our psychologist. We also have a social worker, and she primarily is working with families, individuals, and it's primarily focused on counseling services. She will, if you are requesting to see social work and she thinks you might benefit from being supported from our outreach support, she'll do a referral and get you hooked up with a case facilitator as well. But primarily, she is providing counseling supports. Learning and leisure programming. So that's, if anybody's been with us, that's kind of changing a little bit. So we used to call it PET. We don't really call it that anymore. We kind of refer to it as the hub. This is where lots of our rec and leisure stuff is happening. It's separate from our main office. It's over on Merrittville Highway. And that's where they're running education groups, our music groups, anything physical, anything learning, anything art, skill development, all that stuff is running out of the hub. And of course, we have our regular kind of leisure activities like our bowling and our women's group, our men's group, pub games, stuff like that, plus the additional seasonal ones that change throughout the year. And all that can be found in our learning and leisure guide, which comes out quarterly. And typically that gets mailed to all our clients. If you wanted to check it out, I believe it's also available on our website. On the main page, there should be a link and it pops up as a PDF as well. Vocation. So our vocation program is super busy in the summer because they're running our Gardening Angels program. They're out in the cemeteries, I think 4 or 5 days a week, supporting participants who are earning a competitive income. They also work with people to assist with finding volunteer placements, job coaching. They run a pre-vocation program. I believe it's twice a year in partnership with the hub. And you can also apply for just our vocational program as well. Am I going too fast? I know I'm a fast talker. I need to slow down.
No, you're
Okay. I will slow down.
Sorry, I might be the only one, but I'm lost on um all I need to know is, am I part of the hub now? Is that the group, Katie?
Yeah, it's Katie and Shirley that run the hub.
Okay, I'm good then. Thanks.
You're welcome. Okay. Outreach. So this is probably our largest department. It's our community outreach support services. I think there's, oh gosh, I don't even know, 16, 17 case facilitators now in the outreach department. Typically, you're moving to our outreach department if you're requiring longer term supports. So maybe there's more going on than case management can really get into. The expectation in outreach is that you're meeting regularly with your CF. There are predetermined goals that you're working on, and they're creating a service plan. And so you're working towards those strategic goals. And everybody's different. I think, I don't know what we're calling them now. I think a service plan are individual towards the participants. So for some people, they just need assistance with budgeting. Some people need assistance with meal planning and cooking, some light household chores, putting systems in place to help compensate for maybe some memory loss, things like that. Rural services is basically case management, but in a geographically defined area. So our case manager out there covers between it's like Fort Erie, Ridgeway, Crystal Beach, Stevensville, Port Coburn, I think all the way up to Wainfleet. So that geographical area along Lake Erie. They also run a group 2 days a week. Well, she assists with running the group 2 days a week. And that's a partnership with Brain Injury Services or Brain Injury Association of Fort Erie. So she's a busy person out there. There is one of her, and it's a pretty big area. So our supported independent living program, we have two. One is in Niagara Falls and one is in Fort Erie. And I think there are 6 apartments at each. So these are, regular apartments. I think Niagara Falls, it's 1 bedrooms, Bowden, I think some are 1 bedrooms, some are bachelors. Um, it is also a partnership with Niagara Regional Housing. So people living in this program are also receiving subsidized rent. Staff is there about 12 hours a day, kind of 8 to 8 typically. There's no overnight staff. So the expectation is that people are fairly independent, living alone, and just need some support throughout the day. Oh, there we go. St. Paul is our newest program. It's been around for a little while now, and it is a partnership with CMHA. It is located in Niagara Falls, and staff are there 24 hours a day, much like our residential programs. St. Paul's a little bit different, though. The application for St. Paul does not go through BICR, unlike every other program I just talked about. The application for St. Paul must be completed by a physician, and they're available on the Hamilton Health Sciences website. The application then gets returned after the physician completes it to Hamilton Health Sciences. There is a separate admissions committee for St. Paul. It is also transitional, which is really important to note. Typically, people are there 2 to 3 years and are transitioning out, either returning to live with family, looking for an apartment to live on their own. But it's meant to be short with that increased and intense support, leading to more independence. And our residential services, again, are typically what you would think of as a group home. There are staff there 24 hours a day, 7 days a week. They also are working on goals, same as our outreach department. Staff is there to assist with a variety of tasks, including sometimes ADLs, participating in meaningful and productive activities, establishing involvement in the community. Our residential folks are out and about all the time, are pretty busy, and we have three. One is in St. Catharines, and two are in Welland. Volunteer services. This is typically run by our HR department. So if somebody is looking for potentially volunteer hours or just looking for a great way to volunteer their time, typically volunteers are doing things like friendly visiting with some of our clients, and we also have bingo volunteers as well. And educational services, also, this is typically facilitated by our HR department, but the hub and the rec and leisure folks have been taking on quite a bit of the learning piece and offering more and more learning opportunities that are run through the hub. And that's it. And I think I hopefully stayed in my allotted time. But that is my contact information. That is my email and my phone number if you have any other questions. I am typically the first point of contact once you kind of get through our receptionist. If somebody is calling asking questions, they're typically referred to me. And I guess I can stop sharing. Can I stop sharing? I'm stopping sharing.
Of course.
And that's it for me.
And we will pass it on to Veronica next.
Thank you. Can everyone see that?
Yes.
Okay. How do I go to the next slide?
You should be able to just click the screen, and
Okay.
it should take you to the next one if you click to the
Okay, thank you. Good afternoon, everybody. My name is Veronica Pepper, and I am an acquired brain injury system navigator. My region includes the Hamilton, Niagara, Haldimand, Norfolk, Brant, and Brantford areas. But I'm also the provincial navigator lead, as there are 13 other navigators across the province of Ontario. So every region in Ontario has an acquired brain injury system navigator, and I just provide support and guidance to the others that are out there. So Kelly just did a great job in explaining a lot of the great services that BICR offers to clients and their families, hospitals, long-term carers, and everything else. So my job is a little bit different. So BICR really focuses on like I said, the clients and families, whereas I tend to focus on the system. So I am certainly not going to go through every slide, but I'm just giving you an idea of what the acquired brain injury system looks like. So on the left of the screen in the blue, you'll see the pre-acute. So that's when the injury very first happens. The acute care then so then you're usually taken into the ED, then you go into acute care, and you go all the way across the screen until you could see at the very end, you're back out into the community. Hopefully you've made a decent recovery and you've returned at home. This is what we call a continuum of care, or a clinical service pathway. And in an ideal world, you would come through each of these steps seamlessly and timely, and so that you had the best care that you could possibly have. But we all know in healthcare, particularly in Ontario, that never happens. Our system just doesn't work that well. But there are some areas in healthcare that are even worse than others. And unfortunately, brain injury is one of those areas where we have a lot of problems in maneuvering or navigating through this system as a whole. A few of the areas I have highlighted that have the arrow are the one in green that says transition planning. And then there's a transitioning planning, which continues from acute care. And then down at the bottom is specialized navigation support. So those are the primary area of where the navigators tend to get more involved than the other parts of the continuum of care. But part of our role, and as you can appreciate just looking at this, it's a very complicated, and I think part of the reason that brain injury isn't serviced as well as the pathway could be is because it is very complicated. And the screen you have in front of you, that pathway is just for people that have suffered traumatic brain injuries as opposed to non-traumatic brain injuries, but are also moderate to severe. It doesn't even touch the individuals that are mild concussion Brain injuries, that's a whole different service pathway or a different continuum of care. But the one you have here, you can see it's very complicated. And I think so that doesn't help anything. And part of my job, and I'll get to it a little bit later, is to address the many, many gaps and barriers that patients encounter as they're traveling through their ABI rehab journey back to recovery or back to home and to their community. And that's a big part of our role. So we can become involved at any point in this pathway. And many times we are, but again, those areas are the ones that we predominantly seem to be involved in. To be honest, we have very little to do with any inpatient, be the pre-acute, the acute, even the specialized rehab. It's that step that's going into community where we become more involved. So these are basically what we call our 4 core responsibilities or our 4 core pillars of our job. And at the bottom, you'll see really we do focus more on the professionals, providing them with the support. So it could be a social worker from or a discharge planner from a hospital. It could be a nurse that's working with what used to be called home care. It's a lot of those individuals that they have a client that has been identified as having an acquired brain injury, but they just don't have the knowledge or the expertise and how to manage them. And it can be because they're having problems getting them through the system. It could be because they're having problems with just managing some of the behaviors that they have, which then means they're having a difficult time finding a place to discharge them. Because as Kelly said earlier, a lot of the individuals, and again, the navigators tend to become involved with very complex cases. So what a complex case is it's not just a brain injury. The individual hasn't just sustained a brain injury, but they also suffer from a mental illness, substance use disorders. They could be homeless, involved with the justice system. So these are the ones that we typically get involved with. And so what we have to do is address all those gaps and barriers along that continuum of care to help these individuals, particularly once they return into the community. A lot of our guys, because they're complex, really do require ABI specialized placement, long-term placement. But one of the biggest barriers in the ABI system across the province is that we just don't have enough beds. We don't have enough group homes across the province. There are still areas in the province that don't have any group homes. And so in those cases, they need to leave their areas, their home regions, and move elsewhere in the province. But as Kelly alluded to before, our wait times for our group homes that specialize for individuals with brain injuries is very, very long. And by very, very long, I'm talking anywhere 10, 15 to 20 years. So these are often the problems that we run into. So what we do in the meantime is that we will provide education, resource navigation, complex case coordination, and as a part of all that, we are continually identifying and addressing all of those system gaps and barriers that are being experienced along the way. So just to give you a quick, so who do we educate? Well, we do educate, acute care and rehabilitation hospitals, not particularly the ones that aren't ABI rehab hospitals. So, Kelly talked earlier about Shaver, who may not have ABI specific rehabilitation skills or skill sets for complex cases. So sometimes we'll go out and educate them. Justice agencies. So for instance, that's probation, parole, that can be court support workers, detention center staff. So we'll even go in there, provide education. And often what we're doing is providing education on acquired brain injury itself. It can also be education on a particular individual and any issues, whether they be cognitive or behavioral or cognitive communication problems. It can be so it could be person specific, or it could just be how to manage behavior in general, how to manage cognitive issues, cognitive communications or speech issues. So it could be more generalized as well. So the community healthcare, that would be things like, as I said before, it's now called Ontario Health at Home. It used to be the CCAC, used to be the LHINs, used to be home care. It just keeps changing their titles over and over. So it's places like that we do. Family health teams, we provide a lot of education to. So those are the family health teams where there's multiple primary care or family doctors, nurse practitioners who require or request a little bit more education on acquired brain injury. Again, it can be one of their patient-specific cases, or it can be something more general. In terms of educational institutions, we have gone into PSW programs at various colleges, but one of the things we're currently getting more involved in are the police colleges, really educating them on acquired brain injury, just in general. For Indigenous communities, we get into a lot of the Indigenous health centers and health agencies there. And again, we really try to work closely with them, always still respecting their own practices and their own culture. In terms of social services, that's everything from it could be like social service in terms of like Meals on Wheels. We've worked with Ontario Works. We've worked with the homeless shelters, women's shelters. Addictions is a huge one. That's probably addictions and mental health are probably our biggest partners and our biggest requests in terms of educating. So that's who we do provide education to. In terms of our navigation, complex case coordination, I talked about this a little bit earlier in terms of the complex cases that we really get called in a lot on. And again, that's because a very nice system to manage these complex cases does not exist. So what we end up having to do is we have to pool together what we would call a wraparound team for these complex individuals. So this is where that, and again, this happens more at a system level. So when we're addressing these complex cases and doing this coordination, we really don't have much to do with the individual themselves. It's usually somebody, a mental health worker, a court support worker, a social worker has contacted me as a navigator saying, we have this complex case. We don't know what to do. So what I will do is make connections with everybody that needs to be involved in this complex case coordination and bring them all together. Part of that coordination involves offering the education that I talked to earlier, and then providing what kind of resources. So a lot of times I'll get called into cases, complex cases, where they've never been connected to any kind of ABI supports or services. So in this case, I would refer, if there was anyone from the Niagara region, I would obviously then say, one of my first questions, have they been connected to Brain Injury Community Reentry? And then have they been connected to ABI? Have they been connected to the local associations in the Niagara region? So just making sure that they're connected to all the possible resources that they could be. Again, I talked earlier about the identification of system gaps and barriers. So it can be very locally or regionally, so with an agency. So sometimes Kelly and I are in contact quite frequently. And so, I become quite aware of the difficulties that they have in providing resources and services to somebody. And again, it's, often no fault of BICRs. It usually comes down to just it's a lack of funding, a lack of resources to be able to expand services. And then, of course, we have these horrific longer wait lists and wait times. It can become geographic. So we've got some areas, like I said earlier, where geographically they are located. The further north, the remote areas, of course, really, really hurt for all kinds of resources. But even there are small pockets, even in southern Ontario, where resources can be quite scant and hardly have anything there. So a lot of those gaps and barriers can be very geographic based. Then we have provincial gaps and barriers where we see the same gaps and barriers. And again, I'm going to sound like a broken record. These very, very lengthy wait time for residential or brain injury specific group homes it's no matter where you go in the province, you are looking in that 10 to 15 to 20 year. Neuropsychiatry services that are so badly needed for a lot of our, again, more complicated individuals. We hardly have any across the province. Neuropsychological assessments, they're not funded by OHIP. And so unless you're very, very lucky to have a neuropsychological that's a neuropsychologist that's available to you in your area, you're very, very lucky. So BICR is very, very lucky. One of very, very few of the areas across the province that even has it. And then we have the alternate parts. And so all of this is it's all really kind of trickles down, and all of these gaps and barriers are provided to the Ministry of Health, who is of course the big wigs, they're the big guns, but they ultimately hand stuff down to the alternate ministry contacts. So right now there's been a lot of change in the Ministry of Health in the last probably 3 or 4 years. So we have what's now called Ontario Health. So the majority of the funding responsibilities has been passed off to from the Ministry of Health to Ontario Health. Ontario Health then trickles some of the money down to the Ontario Health teams. And so then we have a number of Ontario Health teams across the province. And then when you're dealing with complicated cases in particular, you may end up really approaching other ministries beside the Ministry of Health. We can report to the Ministry of Community, Safety and Correctional Services. If the justice is involved, we can become involved with the Ministry of Community and Social Services. So there's a number of other ministries that we will report these gaps and barriers to as well. But big thing is, like we said, is that consistent messaging, bringing a broader awareness of what is working, but also what isn't working. And then the other thing we always try to do is keep in touch with researchers, particularly around these systems gaps, because they're the ones that whenever we're trying to advocate for further funding to the ministry or to Ontario Health, they want to see, we have to prove that there is a need. They want to see the data, the numbers that supports that there is a need for something like more group homes, more beds, residential beds across the province. And so what they'll do is they will go out, the researchers will get us that data, and then they'll give it to us, and then we can take it to the ministry. Or we also do something called knowledge implementation, which is just basically following through on what the data, because from the data they will make recommendations, and so we will follow through on the recommendations. And that's it for me. So I'm going to stop sharing. So you can see mine is like, again, it's not direct supports and services per se. I am kind of in the background behind the scenes trying to make the system better so that the next person that has the unfortunate incident of sustaining a brain injury will have a better journey and will have better outcomes as a result of that.
Awesome.
That's it for me. Thank you.
Thank you, Veronica. And we'll hand it over to Allison. And then at the end of Allison's presentation, we will open the floor up for any questions.
Okay, so hi everyone. My name is Allison Reynolds, and I'm presenting on behalf of the Ontario Brain Injury Association. I may refer to it as OBIA throughout as well. So my role at OBIA is as a support service and network advocate. In my role, I assist with our Brain Injury Speaks network, as well as assist on our helpline, both of which I'll provide more details on throughout the presentation. So our mission at OBIA is to enhance the lives of Ontarians living with the effects of brain injury through education, awareness, support. We honor our mission through the various programs that we offer, such as support groups, return to work program, training programs, and more. Again, I'll be going through those during this presentation, as well as how to access them. So there is no formal diagnosis required of a brain injury to access services at OBIA. We do have an age requirement of 18 years and older, and we can help support individuals and their families who have sustained traumatic brain injury or non-traumatic brain injury, and you must be a resident of Ontario. So the first program I'll be discussing is our Brain Injury Speaks Stakeholder Engagement Network, which is a growing community of persons who have been impacted by brain injury. It's a space where people with lived experience, family members can come together, create one provincial voice to inform and respond to issues. Within our network, we publish 5 newsletters a year with topics chosen by the network, reviewing different themes that they find valuable. We also complete different research initiatives that's guided by individuals with lived experience that sit on our provincial advisory committee. Our most recent project completed by the Brain Injury Speaks Network was our financial impact study. So this was a survey that was sent out to the network. And what we found from this survey was that many individuals were unaware of different financial assistance available to them. So based on that information we gathered from that survey, we provided a newsletter that really dove into different financial supports available for individuals with brain injury, how to access them. We provided application forms, things like that. To be a part of the network, you're able to sign up on our OBIA website. You would just need to provide some information like your name, your email, and then once signed up, you'll be able to receive our newsletters, participate in any surveys. Again, those are all optional. However, if you are part of the network, you're not required to participate in any of the surveys. And yeah, so you're able to sign up through our website, or if you have any more questions or information, you can always contact me via email or by phone, which is just on the bottom there. So our next program is our helpline. In terms of accessing community support, this is where the OBIA helpline can be very valuable. After sustaining a brain injury, it can be a bit confusing on where to go next and what support you need, or what might even be available to you. The OBIA helpline, it can be a great contact in this situation. We have a database of resources available for us to provide appropriate recommendations to services to clients in various areas across Ontario. We can provide contact information as well as assist in completing applications when required. We also often connect with other service providers as well, not just individuals living with brain injury or family members. So connecting with service providers who may be working with individuals who have a brain injury, and we can offer information that may be useful to their clients and their situation. Oftentimes, if you call the helpline with situation, I may also contact different ABI navigators if I'm unsure of, different information or projects or programs in the area. I'll contact different ABI navigators as well to kind of help connect as well. I also want to note that our support line is not only for gathering resources, it is also available for individuals who want to talk about their frustrations and impacts of living with brain injury, and talking to a non-judgmental ear when emotional support is needed. Our helpline is open Mondays to Fridays from 9:30 to 4:30 p.m. And if you don't get connected with someone on the line right away, or if you're calling after hours, you can also leave a voicemail and someone will contact you within 2 business days, or you can also contact us by email. Our next program is our concussion support group. So this is an online group, which is a safe place to share frustrations and struggles, learn strategies to maintain symptoms. It's been facilitated by a social worker. Our group sizes typically don't exceed 12 people per group. And the group will run for 1 hour per week for an 8-week session. And again, it is online and it is a free service. We also have an online caregiver support group for both parents and spouses for individuals with brain injury, where you can share experiences and ideas, learn how to manage stress. Again, group sizes typically stay within 12 individuals per group. Again, it's facilitated by a social worker we have on our team. And again, it's 1 hour per week for an 8-week session, available online. And again, it's free. So registration is typically open 1 month before the starting of a group session. And you can sign up on our OBIA website. If you're interested in the group, but registration isn't open yet, you're also welcome to call the OBIA helpline or our group facilitators directly and be placed on a wait list. So when registration is open, you can be notified by phone or email. Groups typically do fill up on a first come, first served basis. However, if you have been a part of the group previously and would like to sign up again, we do ask that you get connected with the group facilitator to ensure that there is room available. We would love you to join again, but if someone else is on the waiting list who has not been able to access the service in the past, they may take priority. Next, we also have our caregiving after brain injury, which is an online self-paced modules available on our website for anyone who's interested. There's no request needed to access this information online. It's just available on our website or directly from that link we have available. So this is a series of 6 modules and resources to help you learn about brain injury. And then I just have listed the different modules that I would take you through. So Brain Injury 101, Understanding and Managing Changes After Brain Injury, Impact to Relationships and Family, challenges and strategies for caregivers, pediatric brain injury, recovery, rehab, and advocacy. So this might be a great resource if you're a caregiver or a friend or family of someone who has sustained a brain injury, to help educate yourself and kind of get some more information about it. Next, we also have our peer support program. So this is free to anyone. This is free one-on-one support offered weekly to the partner and a trained mentor. Communication can be over the phone, email, or Zoom, whatever kind of preferred method. Mentors and partners are matched province-wide based on similar experiences, interests, and preference as far as age, gender, and symptom experienced. It's open to survivors and caregivers who are 18 plus. And each local brain injury association will have a peer support coordinator. So for BIAM, it is Sarah. And if you're interested in signing up, if you again call the ABI helpline, we can help direct you. If you're not in the Niagara region, just thinking more province wide, we'll be able to direct you to the peer support coordinator within your area. And again, this is a free program as well. Next, we have our Return to Work program, which is available for individuals who require support returning to their pre-injury place of employment. To access support, you can complete an online expression of interest, which is again available on the OBIA website, or the direct link is listed below as well if you click on that. This will then notify our Return to Work team if you're interested in joining the program. The team will then reach out to you to help determine which level of support you are eligible for. So there is an online training program available, and there is an option to access enhanced support services, which provides additional support to employees and their employers, which can access virtual support from our OT and a social worker to help support the transition back to work. But again, the enhanced program is in a collaboration with the employee and employer, and both parties would need to consent to receiving support to access the enhanced services available. And again, this is a free program, but I would just like to know that this program does not offer support in resume building, interview skills, or job searching. Next, we have our Northeastern Advocacy Program. So this offers more direct support to individuals that reside in the northeastern part of Ontario. Our program coordinator is based out of North Bay. To access any services available through her, you'd be able to contact her directly, and she'd be able to take you through the intake process. We have a little map of kind of the areas that she serves. So next, we also do have training programs available at a cost. So we do have a Brain Basics program, which provides an introduction to the world of brain injury. It's usually taken by healthcare workers, family members, and survivors. It's offered online. You can learn about parts and functions of the brain, ABI types and causes, consequences and strategies, support team. And we also offer training programs in affiliation with Brock University. So you could get a Brock University certificate after completion. So this typically provides professionals with the tools and knowledge to assess clients in everyday life. So we have level 1 neuro rehab. You would need to complete that to take any of the following level 2 courses that we offer as well. So level 2 courses provide more enhanced knowledge about specific topics such as mental health, addictions, and cognitive interventions. And thank you. So yeah, I kind of went through all our programs there. I have our link to our website, our general line, and our general email as well. If you have ever want to reach out or have further questions.
Awesome. All right. Thank you guys so much for presenting for us. I will open the floor to the Q&A in just a moment. I'm just going to stop our recording now. So thank you again.